months ago, scientists developed COVID-19 vaccines to reduce the further spread of the virus. The next challenge now is how to ensure even distribution. That is our focus today on Sound Health. I am Olasunbo Modukwe. Thanks for joining us. First, we begin with COVID-19 updates.
President Muhammadu Buhari says despite introduced executive order, the number of confirmed cases keep increasing as a result of non-adherence. He, however, added that the order was signed with the best of intentions and not with any motive to punish citizens. The presidency appeals to the state governments, traditional rulers and religious leaders to play active roles in the sensitization and enforcement of the executive order. In line with the COVID-19 Health Protection Regulations 2021, no gathering of more than 50 persons shall hold in an enclosed space except for religious purposes, in which case the gathering shall not exceed 50% capacity. Defaulters are liable to fine, 6 months jail term, or both. Lagos State Governor Mr. Babajide Sanwo-Olu has extended the work-from-home directive to all state public servants on grade levels 14 and below from Monday 1st February to Friday 26 February 2021. A statement signed by the head of service, Mr. Hakeem Muri-Okunla, noted with concern that pockets of coronavirus infections had been observed among public servants in the state. He advised members of staff to stay safe by observing all COVID-19 protocols. Muri-Okunla reiterated that the directive excludes essential duty staff, first responders, as well as officers saddled with assignments on the weekly duty rosters of their respective ministries, departments, and agencies. Till date, over 131,000 cases have been confirmed, above 106,000 cases discharged, and more than 1,600 deaths recorded in 36 states and the Federal Capital Territory, Abuja. Globally, there have been over 102 million confirmed cases of COVID-19, including about 2.2 million deaths reported to the WHO.
Thanks for staying with us. Today, my resource person is Dr. Tunji Funsho, and we are looking at access, storage, and distribution of the COVID-19 vaccines. Dr. Tunji Funsho is a physician and cardiologist. He is also the chairman, National Polio Plus Committee of Rotary International, in which capacity he has been working with other stakeholders in the public health sector for almost a decade to see to the eradication of polio. He is also one of the Time's 100 most influential people in the world. Welcome to the show, Dr. Funsho.
Thank you very much for having me.
Okay, what are some of the benefits of these COVID-19 vaccines? Can I still get COVID-19 after getting the vaccine, and how do they work?
Wow, those are so many questions in one. That's a book.
Yes.
Let's just start, put things in context.
Dr. Funsho, can you hear me? Are you still there?
Medication or procedures. In the community then, we now talk about prevention in the long term using vaccines. And that is how we come to talk about any form of vaccine. COVID-19 vaccine not being an exception. I've always cautioned that we should not look at the vaccine itself as the magic bullet.
Okay.
wear a mask, your chances of getting COVID-19 is just as good as getting the vaccination, which is not going to get to us for another, I'm talking about majority of our population, until about the second half of this year.
Wow.
Now, talk about the vaccine itself. Your second question was what?
How does the vaccine work?
Well, vaccines generally work by provoking the body's immune system to be able to recognize whatever the offending organism is, be it a virus or a bacteria or any other form of infective agent. The body has its own defense mechanism. Even without a vaccine, if a bacteria enters the system, the body, has got different kinds of tools it uses. One, antibodies, which are actually, chemicals that the body produces to neutralize whatever the offending or invading agent is. And the others are specialized cells. They are mostly, we call them T cells. They're a segment of the different kinds of the white cell in your blood. And these T lymphocytes are known to gobble up infective agents. So those are the two main ways that vaccines help the body to recognize a particular infective agent that the vaccine is produced for and get the body's immune system to quickly recognize it, neutralize it with antibodies, and then in a day or so, get the T lymphocytes to gobble them up as much as possible so that they don't turn to disease. That's precisely how any kind of vaccine works.
Okay.
Is to provoke a memory in your system to produce a specific kind of antibodies and T cells to destroy whatever the infective agent is before it becomes disease.
The World Health Organization says about 42 countries are already rolling out the various COVID-19 vaccines. 36 are in high-income nations. With this development, there is a clear problem that low and most middle-income countries are not receiving the vaccines yet. How can this be resolved through the COVID-19 COVAX initiative to avoid vaccine nationalism?
Well, you see, unfortunately, producers of vaccines are in business. They're in business to make profit. And if you don't go in there and negotiate early and show financial commitments, you're not going to get any vaccine. And so what is happening now is the developed, and economically advantaged, parts of the world have gobbled up. They signed up, some of them almost a year in advance, for the production of the vaccines that are going on right now. I was just, watching a news program where the EU president of the EU Commission was, threatening drug companies that have not fulfilled their obligations to even countries that have paid. They've not been able to meet the demand. So we that have not paid anything, you can imagine, what part of the queue we're going to find ourselves. As it is, we have only 100,000, the Pfizer vaccine that is coming to us free by courtesy of COVAX. Now, 100,000 vaccine is a drop in the ocean, even for Lagos State. The medical staff will gobble it up within a few days. Not a talk of distributing them all over the country. I think Lagos State has maybe 3,000, doses. Vaccine is not, I'm sorry to say, I like, to be a great advocate for vaccine, and I am, because that's what we use in ensuring that no more polio exists in Nigeria.
True.
But in the situation we are now, as far as COVID-19 is concerned, we should rely first on what is available, what is proven to reduce and prevent, transmission of the disease, and then start seriously planning for not things you get off the shelf. They have to be produced for you. You can imagine those who have paid have not received. And if we pay even now, how long did it take us to get them? If you buy the cheapest, which is the China vaccine from Sinopharm, $10 million will buy you 20 million doses.
Wow.
20 million doses for approximately 130 Nigerian adults. It's a drop in the ocean. So right now, our strategy really, as far as vaccines are concerned, in my view, will not touch the tip of our challenges as far as COVID-19 is concerned. And it's not just buying the vaccines. You need the logistics to deliver the vaccines. We can see even advanced countries like the United States, they have vaccines they've not been able to deliver to people. Almost 50% of the vaccines they had in store are not yet delivered. So we need to start planning now. Even if we are not getting the vaccine until March, we need to set in motion the logistics. Where are you going to give these vaccines? Who is going to give them? Because they are injectables. And injectables have to be given by qualified, certified staff. And those can only be, medical staff, doctors, nurses, and other trained paramedical people. How many of them do we have to vaccinate 20 million people in a short period of time, not to talk of 120 or 130 adults? Those are not yet put in place. Nobody is talking about them. Vaccines, they come in vials. You need syringes and needles. You need to think about disposal of 20 million syringes and needles within a short period of time. So these are the things we need to start thinking about. But while presently we protect ourselves by ensuring that once we leave our bubble, that's our home, we wear masks, we avoid crowded environments, particularly if they are indoors. If we have to be in a meeting indoors, we want to make sure that we space ourselves well, even when we're wearing masks, and make sure that indoor environment is well ventilated. We should avoid crowds. And of course, whether you're wearing a mask or not, still keep the recommended 6 to 9 feet distance. That is what we've got now. That is what works now. We prepare, like I was saying, all the necessary logistics in preparation for reception of these vaccines.
Okay, there are lots of misinformation about the vaccines. Let's look at advocacy. How best can mistrust and public fears be allayed in the country?
Well, it is important when you are asking people to do something they've never done before, to let them be part of the dialogue. For them to understand how and why, for them to appreciate the fact that vaccines are safe. Vaccines have been responsible for the reduction of our infant and child mortality by almost 60% in the last 15 to 20 years. So we know they work. We also know they are safe. Otherwise, we will have had huge reports of all the vaccines we've been giving children for decades. I'm talking about measles, diphtheria, meningitis, tuberculosis, and so on. And of course, in recent times, we've been given hepatitis, and to girls, we've been given the vaccine for prevention of cervical cancer. So we know they are safe. We know they are effective because polio is an example. Using vaccine has brought us to a zero case of polio. And as we continue using it, we've not seen any case of polio in Nigeria for more than 4 years, going to 5 years now. So they work, and generally they are safe. So we need to advocate using influencers who the people believe and trust. Like we did for polio eradication, our traditional and religious, leadership, structure are very, very useful. These are people who live in their communities. They speak the same language, the people, they have the same culture. They trust them, they believe them. And if those people take this message to them, and the message deliver the vaccines to those who require it. And in this particular case, it's to all the Nigerian population, bar the children for now.
Let's look at storage and distribution. Considering your expertise in immunization and the peculiar nature of the country, how do we avoid wastage? Do we have enough capacity and resources now?
Well, thankfully we have. Thankfully we have a very effective and generally efficient cold chain system. We have a national store in Abuja. We have 6 zonal stores. We have stores in state capitals, and we have local governments. And so the vaccines, as at when required, can be moved from the national cold room, which is in Abuja, to the state cold stores, and as when needed, to the local government, where it takes off when needed to the either primary health care centers, or if you're doing campaigns, vaccinators pick it from there and go door to door, to the immunization. So we have a good and relatively efficient cold chain system, even in areas where electricity is not that stable. Solar panels, drive the generation of the cold rooms, so that vaccines are not wasted. So we have a reasonably good cold chain system. What we do not have, we will not equip for now, is the vaccines that need to be stored at -20 to -70 degrees centigrade, which is what the Pfizer vaccine and a couple of other vaccines require. But I'm sure in due course, we'll go for those vaccines that already we have the logistics, capability to handle, so that the vaccines will get, to the people who need it in the right conditions, so that they're effective.
Okay, Dr. Funsho, who should get access to the vaccines? Many have advocated vaccination of essential healthcare workers in place of the vulnerables. Do you share a different view?
No, I don't share a different view. I think it only makes sense that those who are most at risk of contracting the disease, and also most at risk of dying from the disease, and statistics all over the world, including in Nigeria, has shown that we've lost about 20 doctors in Nigeria and countless nurses. So it goes without saying that in any situation, you first of all protect the most vulnerable, and then you can then cascade down. So I'm totally in support of that.
How do we ensure availability and fair access to the vaccines?
Well, that is for the powers to be, to decide, because access to the vaccine is presupposing that you have the vaccine. As I said earlier, we do not have any vaccine on ground as I speak. The first batch of the vaccine that we're expecting, hopefully, will come by the second half, of this. We are in January, yes. Will come by the second half of February if we are lucky, because that is free, and that is just nothing as far as I'm concerned. 100,000 doses of vaccine is only for 50,000 people, because you need 2 doses, to have at least an immune coverage. If it is a Pfizer, it's about 90%. So you're talking about 50,000. 50,000 would not, cover essential workers in 4 or 5 local government areas in Lagos State, not to talk of, the whole country. So we need to have the vaccine first, and we need to pay for the vaccine first. Having done that, we now ensure the logistics I was talking about earlier is available, because this thing has to be given, these vaccinations have to be given by injections, and not everybody is licensed to give injections. And the numbers of people who are licensed to give injections already are overstretched with the COVID-19 pandemic. So where are we going to get these extra people who will be given injections in the average, when we do NIDs, we are vaccinating approximately 50 million children over a 4-day period. And that is possible because the vaccine is a drop. You don't need certified people, to do it. You can teach somebody within 5 minutes to know how to hold the vial, how to preserve it when they finish using it and so on. But injectables are a different ballgame entirely. So, and I've not seen much talk about, planning the logistics out there, for us, having been so connected, with our GPI partners. I know a few things are being done, but really we are still very, very off the mark as far as starting immunization or vaccination for COVID-19 in Nigeria is concerned. We're far away from the starting line.
Are we likely to pay for these vaccines when we eventually get them in the country?
Are we, as the population?
Are we, as a population? Is it going to be free like in other climes?
Yes. We have been assured by the National Primary Healthcare Development Agency that the vaccines are going to be free.
Okay.
Of course, that does not preclude private hospitals, who are licensed to do so, to import vaccines on their own, which they are also allowed to do, as long as they are NAFDAC approved, to give patients privately, and whatever they charge is essentially a commercial venture. But government vaccines are going to come free, according to the government.
Experts have raised the need for critical research on administering vaccines in different target settings. What should be done about vaccination delivery strategies and schedules now?
What should be done
about vaccination deliveries and schedules to meet up?
Are we talking now about our normal routine immunization?
Yes.
Or for COVID-19?
Our routine immunization and COVID-19.
Well, for routine immunization, I think we are generally good, and parents are generally very good at bringing their children to facilities. The challenge has always been enough facilities accessible, to parents to take their children. If you don't have a health facility close to you that you can walk to, it is tough because there's a lot of money. Of course, accessibility can also be in the form of non-existence of primary healthcare facilities, for parents to access, to get routine immunization. So those two things, deprive families from getting routine immunization. Where they're available, they are free. But you have to get to where they are available in order to get them.
All right. Thank you so much for always making time out of your very busy schedule. We appreciate you, Dr. Funsho.
Thank you for having me and giving me the opportunity.
I've been talking to Dr. Tunji Funsho, a physician and cardiologist. Dr. Funsho is the chairman, National Polio Plus Committee of Rotary International, in which capacity he has been working with other stakeholders in the public health sector for almost a decade to see to the eradication of polio. He's also one of Time's 100 most influential people in the world. Thank you so much for your time once again. All right, we have been discussing COVID-19 vaccines, how to ensure storage, distribution, and access. Sound Health continues with trending health reports. This is where we say thank you on today's episode of Sound Health. Remember, wearing a mask, washing hands for at least 20 seconds, and physical distancing are key in ending further spread of the virus. Ensure you observe these protocols at all times. For comments and inquiries, please send SMS to 0035826603 or follow us on social media at LTV Social, #SoundHealth. A sound health is a sound mind. Make healthy living your choice.